Welcome and thank you for joining us today. Today's discussion draws on original research from Reveleer and Mathematica, examining how health plans and provider organizations are investing in technology, governing AI, and preparing for audit exposure. Before we dive in, let me introduce our speakers. First of all, I'm Marina Hildebrandt, and I'll be moderating today's session. I hold a doctorate in health innovation and leadership. I am also a board-certified nurse executive advanced. I am the product marketing manager here at Reveleer, but my background is clinical, and that's the lens I bring to conversations like this one today. Today, I am joined by Jay Ackerman. Jay is our Chief Executive Officer and President of Reveleer, where he directs the company's vision, strategy, and growth across risk adjustment, quality improvement, and clinical intelligence. He has spent more than 30 years in the healthcare technology leadership space, including prior roles as Chief Revenue Officer at Guidance Software and senior positions at ServiceSource and WNS. Jay holds an MBA from NYU's Stern School of Business and a bachelor's degree in economics from Connecticut College. We also have Vindya Dayananda. Vindya is an executive vice president of corporate strategy and development here at Reveleer, where she leads the company's long-term strategic growth initiatives, including mergers and acquisitions, partnership alliances, financial performance, planning, and investor relations. She brings 15 plus years in healthcare technology and services, with prior experience at Oak HCFT, supporting investment thesis generation in value-based care, and at William Blair, leading sell-side transactions in healthcare technology sector. Vindya holds a BA in economics and an MBA from the University of Chicago. And finally, we have Ngan MacDonald. Ngan is the Director of Data Innovation Lab at Mathematica, where she leads a team of data scientists helping public and private health organizations apply their data to generate meaningful insights and advance innovation in healthcare analytics. She also serves as Chief Data Operations for the Institute of Artificial Intelligence in Medicine at Northwestern University. Ngan brings more than 20 years of health data analytics and operational experience spanning analytics, interoperability, and she holds a BS in Communication Studies from Northwestern University and an MS in Information Systems from DePaul University. Welcome, speakers. Before we get into the nuts and bolts of this report, I'd like to hear a bit more about who we have in the audience with us today and what challenges they face. Let's start with a polling question. Which of these best describe your organization's biggest value-based care challenges today? Scaling operations as VBC continues to grow, too many manual workflows, data quality and interoperability, or keeping up with regulatory requirements. Can see the results popping in already. It looks like we have a mixed bag, data quality and interoperability taking the lead.
Well, seeming to line up already with some of our trends that we're going to talk about today, Ngan.
Yep. It's going to be a good conversation, Jay.
Awesome. Data quality and interoperability continues to take the lead here with 43% of the share. In second place, it looks like we have too many manual workflows still being a barrier in value-based care. Ngan, these are a great lineup for getting us started here today.
So I can talk a little bit about what we did, which was in March of this year, Reveleer commissioned Harris Poll to do a survey of 200 healthcare executives about their adoption of technology in the value-based care space. Mathematica did an independent analysis of the collected data, and this is year 2 of the survey, and there are some key trends that we saw in the results. I'm going to give you an overview of the 5 key trends we saw, and then I'll turn it back over to you, Marina, to moderate the discussion. So basically, last year's report showed that companies all expected value-based care to grow, and trend 1 in this year's survey confirms that But interestingly, value-based care contracting is growing faster than the operational processes that can support it. The survey finds that while there's more value-based care contracts, the proportion of the business is less. In trend 2, we see that companies have all purchased the technology and the infrastructure they feel that they need for value-based care. But the survey indicates that the companies don't have the mature workflows to be able to support it. As is typical of technology adoption, the workflows need to change in order to realize value from the shiny new tools. And what this survey finds is that companies continue to rely on manual workflows, which hamper their ability to realize ROI from their infrastructure investments. Now, in trend 3, we find as well that while investment is in security measure has ticked up, it's appropriate with all of the higher risk of cybersecurity breaches that we see due to AI. There continues to be a lack of confidence in the data. Organizations are spending a lot of money securing that data that they don't necessarily trust. And then in trend 4, we see that AI governance is a huge gap. And companies also don't necessarily trust the vendors that tell them that all the things can be solved with AI. And then lastly, in trend 5, the regulatory pressure is increasing as new value-based care models are being rolled out. And the RADV audits put these companies at risk if they can't show where the risk scores are substantiated by evidence in their medical records. So essentially, what we found is that companies have bought the fancy car with lots of bells and whistles, and now they're learning how to drive it while the rules of the road continue to change. So I'm going to kind of go through a couple of the trends that I see as interesting. I wanted to show some of the data for trend 2, which we're calling the infrastructure paradox. You can see from the response for both payers and providers, almost everybody has the technology, and the problem is the workflow around it. And we saw that in the poll response as well. The platforms are seen as too complex, and manual processes are still dominating. So you own the car, but it's not the same as knowing how to drive it. I think what's the gap isn't really in the tooling, it's the workflows and governance that turns those tools into outcomes. And in trend 3, we see the third trend that I want to delve into is between what the organizations are spending their money on and what they say is important. This is the data behind the data quality, trust, and performance segment. Organizations are integrating and securing the data they still struggle to trust. 98% affirm real-time data is critical for proactive care management, but only 29% name it as a top investment priority. That's a 69-point gap. This leads into the top integration barrier, which is data quality. This generally requires investments in governance and data collection. Data accuracy carries direct financial implications under RADV. So diagnosis that fail documentation will lower RAF score and raise audit risks. So everybody says they value the data, but the investment in data quality is just not there. And then in trend 4, I'm positive I'm not telling you anything that you don't already know, but every organization is using AI. That said, our survey indicates that AI governance is very slow to catch up to adoption. There's actually a huge decrease, a 22 percentage point drop for providers and a 17 percentage point drop for providers in AI as a strategic priority. The fear of AI hallucinations has grown significantly for both providers and payers. 22 points for providers and 11 points for payers from last year. There's been an increase in the feeling that vendors overpromise their value-based care capabilities. So 93% of the organizations believe that vendors overpromise on value-based care capabilities. Contrast that with the new question this year that showed that 68% of the payers and 74% of the providers rely on third-party AI vendors. So while companies don't have a lot of trust in vendors, they are relying on them for AI delivery. It's not surprising. Corporate boards are asking how companies are incorporating AI. So there are a lot of vendors because AI makes it easier to start, but large companies like AI and Anthropic are building in new capabilities. And so like the whole environment is really shifting quickly. Another new question we added this year is an organization's ability to detect when AI is wrong. Only 35% have a documented process. And this dovetails with a McKinsey report that I saw late in 2025, which shows that companies are simply not seeing the ROI on their AI investments.
Awesome. Thank you so much, Nan. With that, that would bring us to our poll question number 2. How confident are you in your organization's AI governance? Very confident, somewhat confident, limited confidence, or just unsure? I see limited confidence and somewhat confident taking the lead here. Jay, as
Yeah, I
those
think we're
come
going to see
in, I
this
think
one
it,
change quite a bit over the next year.
I think
so
in
it looks
general, it's been changing the technology, and how quickly we can adopt it isn't really catching up to people's expectations.
very good. All right, so that leads us to time to jump into this discussion. Jay, you heard the results here from Ngan. We have payers that you talk to on a national level. Walk me through some of the observations you're making from the data that Ngan has presented.
Hey, thanks, Marina. There's a lot of interesting data points in what Nan has briefly walked through. Maybe I'll call out a couple. The one first, the data point of 93% of org-safe vendors have overpromised on VBC capabilities. Interesting. You could say at some level it's concerning that virtually everybody believes that we're overstating capabilities. And I think what's at the heart of that is we don't have standards of measurement yet. We haven't agreed on what great looks like. You say a car rolls off an assembly line, and Nan, you made a comment about a car driving earlier. Like there's universal standards of quality now that are out there, and how quality of a Nissan is compared to the quality of a Chevy, compared to the quality of a Mercedes or BMW, et cetera. But in these products being released and deployed, it's happened so quickly, we don't have agreement and alignment around what accuracy looks like, what noise means, how you consider recall. And that, I think, leads to this view of overstatement of capabilities, because each party is putting their own lens on how you judge and measure quality, and how you judge and measure what great and good, what good and great really look like. So that one really stood out for me. I mean, it's amazing how quickly we've gone from like 0 to 100% adoption and usage. Where have we seen a product go through an adoption curve that fast? And so that data point is also, I find that exciting. But then when you see the concerns about data quality and then readiness on compliance and infrastructure, that's not surprising. So those data points, I think, are understandable based on how quickly we've gone to 100% kind of, purchase within payers and providers for these AI-based solutions.
Very good. I think that one of the things that you just called out, Jay, was that AI adoption reaching 100%. Yet the strategic commitment to AI fell from 40% to 23% among payers. What do you think is behind that shift? And I invite both you and Nan to weigh in on that one.
Sure. You want to go first, Nan?
Yeah, sure. I think that, what I'm seeing out in the marketplace is that there is a lot of emphasis on cybersecurity risks. So the same tool that is theoretically going to make it so much easier for us to be able to implement, bright and shiny new things is also the tool that is being used to increase cybersecurity risk. So there's a lot of investment, and we see that in the trend analysis. And then, people are cautious. I think the AI adoption is a little bit deceptive because I think everybody has AI like at their fingertips here and there in terms of chatbots and ambient listening, but I don't think that it's being used effectively in the workflows.
Yeah, if I could just add to that, I think that's one of the things that I see. You see some of these fast moving trends, and they're often driven by a senior leader who pushes the organization to adopt. Reads, is at a conference, talks to a peer, we got to get moving, so go. And so people have jumped on it. And to your point on workflow, these solutions have been bought because they really are compelling, but they've been dropped into existing workflows. And to get the maximum value, the workflow really needs to adjust. And yet, within these organizations, resources are scarce, and those scarce resources make it difficult for people to step back, examine the workflow, adjust it, and optimize it to that new technology.
I think I'd pick up on a couple of things there, Jay, that you're pointing out. One, I think that we had it in there subtly, fear of AI hallucinations being a barrier to adoption. I think that another thing I'm picking up there is governance models and what does that look like? Vindya, I'd like to invite you to talk about what that looks like as you're doing your strategic planning, and what are our organizations facing in this space when it comes to AI governance?
Yeah, so when it comes to AI governance, we're looking at a couple of different things, right? Um, Within governance itself, it's really a question of, is it a box that you're checking, or is it truly built into is it truly built into the product, and is it truly built into how they measure one vendor from the other? So from an AI governance perspective, organizations are looking at it from two different ways. Procurement, when they go out to procure a vendor, what are the criteria in which they want to evaluate one against the other? And the second is, how are we going to measure them? How we're going to measure the outcomes of one vendor to the other? And then internal readiness, right? That's the third sort of pillar to AI governance amongst organizations.
So all of this depends on the underlying data being trustworthy, right? 98% of organizations in the study called real-time data critical. 29% identified that as the top investment priority. That 69-point gap that Ngan pointed out earlier. Again, I keep coming back to that. It's pretty striking. Data quality also ranks among the most frequently cited barriers to operational performance and integration. Vindya, with that 69-point gap and the organizations calling real-time data critical, let's talk about what that means. I think that what are the high-performing organizations doing beyond that governance model to really operationalize those models?
Yeah. So the gap that you're referencing here is really the gap between people saying, respondents saying that real-time data is critical, but only 29% that fund it as a top priority, right? So just to level set here. I think the first thing for us to understand is that real-time data infrastructure doesn't necessarily have a natural budget owner the way in which a point solution might. So it tends to lose to line items that maybe a program manager might immediately point to in an RFP process. But that said, we are seeing on our side that forward-leaning and forward-thinking plans and providers are really starting to fold in real-time data investment into their audit readiness budgets, right? So let's just look at RADV as an example. Defensibility for RADV entirely depends on timely, complete data, and that's really served as a catalyst for reframing how dollars are spent on real-time data. And I think that gap is going to narrow in the next 6 to 12 month cycle.
All right, let's take that a different direction here. And how do we translate that into the financial risk and risk adjustment and quality programs? Ngan and Jay, give us the downstream consequences of that highlight that Vindya just pointed out.
Well, I think this is definitely more in Jay's wheelhouse than mine, but I would tell you that, for every time that you cannot substantiate the risk scores that you're getting in your RADV audit, it's going to have a direct financial implication. I think that there's still some outstanding, if I remember the report, some outstanding legislation that is still, in terms of like what the actual financial impact is, but we know that there is going to be financial impact.
Yeah, I think maybe to add a little bit of how I see it unfolding. We know that confidence in risk adjustment is critical to how value-based care operates. And to ensure that we have confidence in that, we also have to have compliance around it. And so, the RADV audits were often, they were years away from, we're auditing 2016 and 2021, for example. And so it's just so far removed to the actions that took place. And so there's been deliberate action to tighten that, ultimately mirror something that looks more like the ACA audit. And in doing that, I think it tightens up the system. But when you do that, and now it's real, traceability is really important. And you can think about chain of custody, right? Chain of custody in a lot of places around how you care for a patient, how maybe a pharmaceutical innovation, kind of tracks through and gets approval. So traceability is really important. And so when you get to data, understanding what has happened to that data every step of the way and being able to kind of review that, audit that, and have confidence in that. And so I think that's become super important. I think those who are going to succeed will be able to show real traceability, and you'll see payers and providers gravitate to solutions that have built-in kind of audit controls and traceability and chain of custody.
Sounds like there's a bit of a theme of trust there, which segues into our topic of the 93% of organizations in the study agreeing that vendors have overpromised on value-based care capabilities. Vindya, what accountability should health plans be demanding from their vendors, and what are forward-thinking organizations already requiring?
Yeah, so to set the stage here a little bit, 93% of respondents explicitly said that vendors have overpromised on value-based care, right? And the irony here is quite real. VBC was propped up to measure very specific measures and outcomes, yet health plans and providers have difficulty measuring the outcomes and contractual performance from their VBC vendors. A large part of the reason is because the lack of methodology transparency before signing. So, for example, what exactly does accuracy in AI-assisted coding really mean? And we see varying definitions and varying benchmarks that are really, created by vendors, right? Producing the sort of the stats around accuracy. And Jay mentioned recall. These are all very important things when we think about AI. And as AI is being ubiquitously thrown around as a product term, plans and providers want true sample sets that demonstrate accuracy and not just content that might show up on a slide. I think the accountability shift is also showing up in contract structures. So more plans are pushing for performance-based terms tied to audit and coding outcomes and not just uptime or feature delivery. And, we think this is what's going to differentiate the vendor landscape.
Good. Let's move from data challenges to the investment decisions organizations are making to address them. Organizations are under pressure to consolidate vendors, integrate platforms, demonstrate return on prior technology investments, all while managing the active RADV audits across those Medicare Advantage contracts. Criteria for evaluating technology has shifted, as Vindya has just pointed out. Jay, what is on the technology evaluation checklist today that was a lower priority 2 or 3 years ago?
Hey, Marina, great question. I would offer a couple of things that I think are on the checklist now that maybe were talked about, but you didn't see them defined. So you're seeing people seek to understand how data is being kind of cleansed and normalized. So they want to understand, to that point around data coming in and trusting the data. I mean, interestingly, we have a set of our leaders gathered here today, and as Vindya could probably nod her head on this, as we talk about broader use of AI across our own enterprise, we're talking about how we standardize data within the company so that you know that a data input used by one function is used consistently by another. The definition around that is the same. So you're looking for, their vendors are being asked to define those elements more. Vindya called out the performance standards. There is an ask to stand behind outcomes now. And if you're going to stand behind an outcome, you have to have clarity around that unit of measurement. And I think there's a bit of a tug of war between the customer, the buyer, right, and the provider around how you define that. And so some of in the provider, in the technology community are trying to front run that and get out in front and really set the standard and define it. And you're seeing payers in particular that have a little bit more market heft, really putting their kind of fingerprints around those definitions. Ngan, you're nodding a little bit. You care to add a little more color to it?
Yeah, I mean, I'm not in the same rooms as you, Jay, but what we see on the policy side is that that we are continuing to like see CMS change and like formalize rules around this. And then, you know, like there's initiatives like Kill the Clipboard where they're trying to make sure that you know, systems are moving forward with like creating more electric, you know, like digital records. I always make the joke that we're the last industry standing that's keeping the fax machine alive. And so I think a lot of this, you know, to me boils down to the idea of being able to trace the data provenance. And that's really going to allow you to prove that like whatever risk scores you're putting on, you know, in your health plan, that's going to be auditable.
Now, I think I want to dig a little deeper into what you're saying there, particularly around weighing in on interoperability and integration, because I think that's another big part of the initiatives that we're seeing from regulatory agencies at this time. What is the data showing there?
The data is showing that there's an importance placed on, you know, in the survey, everybody thought that interoperability was very important for value-based care, but the investment continues to lag behind. I think I don't have the numbers, but I would say that we continue to see efforts like TEFCA and some of the other interoperability standards continue to build. And that, you know, there was a little bit of a lull, and I feel like the rulemaking has really picked up on interoperability.
Jay, do you want to weigh in on that, on as far as the implications for payers and providers and just the weight that they're having to deal with across not only tech stack management, portfolio management, but just the context of that?
Yeah, that's a great topic, Marina, and I think what we've been anticipating a stronger push for vendor consolidation, and we're seeing it. And I think the view of it maybe 12 months ago is that vendor consolidation was largely about financial leverage. We know that healthcare systems and payers have been challenged financially, and so hey, if we consolidate from 5 to 3 or from 5 to 1, we can gain more leverage. But I think the reality now, and it's coming out in the data here that Ngan walked through earlier, is some of that consolidation now, or that push, is actually being more strongly driven by managing the data, protecting data leakage, and understanding the weight to have your data running through a variety of AI systems and models driven by others with their own kind of methodology. Because one of the things that I expected to play more strongly into the AI kind of buying decision already is, hey, tell us how your models work. And there was a lot of energy around that early, and that's dissipated because I think the focus is on that front end data management. So the data weight is real, and I think that's driving more consolidation around technology decisions.
And if I may just add, I think it's worth stating that when it comes to portfolio rationalizations, plans and providers are ultimately looking for accountability. And on that front, just not all vendors are proving equal here, right? Some have broadened their platform by bolting on adjacent modules and acquiring these capabilities. And others have actually invested into building a data lake, to Jay's point, with that can really produce a longitudinal patient level history. So it matters because a continuous longitudinal record will hold up in an audit situation, looking back multiple years, and ultimately the layer of the data foundation below these capabilities and AI assisted workflows matter more when we think about the rationalization that's happened in the last couple of years and why it's going to look different from this point on.
I think that's a oh, go
um,
ahead.
I think, Vindya, that points out something that I often tell people is that it's really important to be able to have a vendor that is going to be your data partner, that really understands the landscape of healthcare, because the healthcare data is so complicated. And what I see is that there's a lot of vendors. AI makes it really easy to like to create new software, but it doesn't replace the idea of like, if you know the industry really well and you know healthcare really well, you can like guide people along. Like, it's important to have that partnership and to have that trust with your partner in order to make any kind of like tool implementation successful.
Very good. That brings me to the third audience poll question. In this context of increased audit scrutiny, how are we prepared? Are we very prepared for tomorrow, somewhat prepared, unprepared, or completely unprepared, very unprepared? I'd like to see where the audience is sitting on this. Somewhat prepared is taking the lead here. The reason I want to move gears here or shift gears here, team, is because I want to think about everything that we've covered. I want to give each of us a moment to look ahead and think about what are organizations prioritizing right now. So as you can see, somewhat prepared came out first, a few in the underprepared, and some are in a good spot being very prepared.
Hey, Marina, what was your question again on that
Sure.
front?
What are organizations prioritizing right now? We've covered readiness gaps, data investment shortfalls, governance requirements, vendor accountability. I just want each of us to take a moment to think about direct recommendations we can make. What are the CMOs and risk adjustment leaders in this audience needing to plan for right now? What do they need to hear?
Well, one thing, maybe just to start it out, I really think this data governance is super important because where it sits, like the ownership of it isn't clear. And so what I think is really important is getting business stakeholder, legal, compliance, come together and define how that is going to be governed and managed, because it has just massive impact. Your ability to consider other solutions, it will be quicker because you'll understand what must be true for you to act. You're going to have a proper lens on how you evaluate solutions that have already deployed where critical data is sitting. This question of traceability, if you're called out in an audit and you have to defend yourself, can you do that? Is that an easy thing to unlock and do, or does that unleash a flurry of activity where people have to drop everything they're doing to go get the data again, right, and do work all over again to pull it together and run it through multiple kind of levels inside an org before people sign off on how it's going to get released. So I think we're going to see people lean into the governance side and get that right. And I think we may even start to see some third-party organizations play a stronger role in helping shape and define what kind of best-in-class looks like there.
So I think, Jay, what you're saying about data governance dovetails directly into data quality. Good governance leads to good quality, and good quality data also leads to more accurate AI. And, like being able to use high quality data allows you to anticipate what is happening. Who are your members that you're going to go after, your patients who you're going to be able to anticipate what might happen to them, and like deploy care management processes around folks that are trending high on the risk score. So I think that's really important. And I don't think that you can do that. You can implement any of the software really well if what you see is that you just have poor data quality within your organization.
To piggyback on that, Ngan, what about building error detection processes? How do we get that into that part of the conversation? And maybe Vindya, you can weigh in there too.
Yeah. So I think that that's one area where, folks are looking into things like agentic AI in order to look and see when errors are happening and being able to remediate those in a semi-automated way. But I think the important thing to note here is that this is high risk for organizations, and healthcare in general is high risk for individuals. And so there's always got to be a human in the loop when you talk about deploying AI solutions.
Yeah, I'll maybe piggyback off of that. I think ultimately we are not quite there on autonomously coded, any type of autonomous AI solution that providers and payers can trust. And I think that's important recognition, particularly when you ask the question of what advice, if any, would we offer to the CMOs out there? They're front and, in that line of getting feedback from doctors that are, working through each encounter. So what we want to ensure is that the data that we take, the data that is being coded, is being analyzed, has a human in the loop to be able to really identify and prioritize what gaps to close, what areas to really dig into in an encounter, and then if you look at the retrospective risk side of the house, ensuring that we aren't just taking what AI spits out, because it's not nearly as perfect. And so I think this is where plans and providers really need to find partners that are willing to work with them on transparency and working with them where they can ask questions about how is the AI truly working and how are these models working, and give feedback, because it's not perfect. We all use AI in our daily lives and we know it's not perfect. So why would it be in something as complex as healthcare, where, things are very, it's especially important to get it right.
Jay, I think I saw you taking some notes there. I'd like to invite you to piggyback on the comments that were made.
Yeah, well, I was just thinking, and I'm sure everybody that's on this webinar has probably experienced it. You hear the term AI slop. Like AI slop in crafting a social post is a missed opportunity. AI slop when running mission critical healthcare processes like risk adjustment, care gap closure, care management leads to tremendous organizational liability. So the impact, the ramifications of it are massive. The unlock done right is game changing. The unlock done right allows organizations to move from selectively identifying members or patients to focus on to focusing on everyone that is in their care. And that is I think it's what we're all excited about, because we know that, like, kind of the secret here, the unfortunate, like, dirty secret, is not everybody gets the same level of attention. And so that's really exciting. But the accountability and the trust and kind of verification of the outcomes is super important, right? And it goes from being kind of a nice to have to a must have. And so getting aligned around how you measure, getting around how you audit, understanding how your technology partner audits their own kind of outcomes and how they use those results to train, improve, and to frankly correct outcomes that might have come off the assembly line before that aren't accurate, is really important. Those who get that right will move at light speed.
Hearing you talk about the clinician perspective makes my heart happy, Jay. Vindya, I want to punt it back to you. From a strategy and investment standpoint, where does a health plan or a provider group get the highest leverage right now? I'll use that question to kind of close us out here.
Yeah. Great question. I think if I had to rank it, and I'd start by saying funding the data foundation first, since it's the one investment that, that makes every other governance and AI initiative much more defensible and scalable in the future. And we talked about that gap, right? Even though it's high on the priority list, it's not nearly being funded as much. I think, if you look at from a strategy investment standpoint, CMS itself has said that, mandatory models will have to be a part of the equation going forward. We're already seeing it. Team went live earlier this year, putting hospitals at risk for surgical episodes. CMS has proposed a nationwide mandatory expansion for specific types of care. And then there's introduction of the WISER model, and it really previews how the tech stack and payment models are about to be linked, right? So plans and providers that fund the data foundation now aren't just de-risking an audit, they're buying optionality for other scaled products to be layered on top of their programs, and ensuring that they won't be retrofitting it into their infrastructure under a harsh deadline. So I think that's the biggest area of investment that we see. We've been following the trends. One of my favorite things to do is go back and look at the trends coming out of RISE every year. Several years ago, it was claims over medical records, and it's just very apparent, right? In the last 2 years, AI and governments getting closer to the data is the biggest driver of a curiosity, and we hope that really turns into investment.
Very good. Any other final thoughts from our panelists before we head into questions?
I mean, I will say the thing that I tell people all the time is if you want good AI and good technology, you have to be able to put in the fuel, which is good data. Otherwise, it's not going to work. And, like to Vindya's point, like data is the foundation for everything that we're doing as an industry.
Good. With that, I'm going to go ahead and turn it over for questions. I'm going to pop into the chat here. Give me just a moment. I have a question coming in from Tori. It feels like regulatory environment adds a very complex dimension to AI integration and value-based care. How are AI tools or vendors influencing the regulatory environments and vice versa?
I'll jump in first on that. Look, I think you can see kind of quite visibly that HHS and CMS are inviting private companies to speak up. They are very open to the private sector and are looking for innovators to come forward and show how they can take kind of waste out of the system, but also to identify places where a regulatory burden may be getting in the way of kind of a mission and objective that like people are aligned around. So it's been really exciting to see that kind of flow of that dialogue that is, I think it's quite active and it's earnest.
And what is your prediction for 3 to 5 years from now? How is this landscape shifting?
Well, I think, at least from what I've seen on the AI front, that there has not been the same, um, uh, like, there doesn't seem to be the same push at the federal side to be able to regulate AI as there has been in our European counterparts. But what we are seeing is that on the state side, you have states like California and most recently Illinois passing their own AI governance bills. And so I think that, it just is not, hopefully not going to be a sort of winner takes all attitude towards AI that it has been towards technology in the past.
And on that, if I could just ask you a little bit on that. So I do see how that's unfolding. California, place I call home, and as a technology vendor building solutions, the idea of states having different standards like causes me to lose a lot of sleep at night.
I agree.
And so, yeah, so I'm really hopeful that the federal government will get its will act, will come together and put some standards in place that allow this country to move, kind of not get bogged down in kind of state level regulation. And I think we'll see that in the 3-year window. Do you agree? Do you think that will unfold?
I mean, I certainly hope it does, Jay, but I mean, hopefully to reassure you a little bit, I think a lot of what the most recent Illinois bill is based on is the California bill. And as I understand it, there's a consortium of states that are trying to put in place similar frameworks so that there isn't this hodgepodge of different types of regulations. But of course, it's not entirely going to work because each state is its own entity and being. And so I do see that they are trying to do some AI regulations. It's really hard in this climate to see how they're going to be able to pass something that massive.
All right. I don't see any more questions in the chat right now, but I would invite all of you to share what outstanding questions did this data leave you with? Like what's ruminating in your mind as we walk away from this report and think about next steps?
Yeah, hey, Marina, if I could, to anyone who feels so inclined, it's been exciting for us to share the results of our survey for the second consecutive year. And as you wrap up a year, you start thinking about what are the key questions for next year. And so it would be great if anyone feels inclined to put in the chat like a key question that's looming as we think about how this might unfold, in 2027.
I misspoke. There is one more question that got dropped into the chat. AI is driving or perhaps even demanding evolution of data governance frames to address vertical and horizontal interoperability with new kinds of partners, whether it's social service, housing, etc., who are not historically connected through formal frameworks or workflows, because there has not been enough incentive to do so. Any suggestions about how to best approach data interoperability with orgs that aren't currently in a value-based reimbursement model and don't have the data agreements, but do have the metrics that should be included?
So I'm also a part of this Capricorn network in Chicagoland where we collect a lot of different data in order to fund to allow for research and what I see is that each organization that isn't covered in the value-based care landscape is really trying to connect data together because there's a recognition that every piece of your life actually influences your health. And so I guess like approach in terms of interoperability, like when I sat on the insurance side of the house, it felt like those organizations really needed help from their insurer partners. And I think like last year, the report spent a lot of time talking about how aligned payers and providers were in like that they were all reaching for the same goal. We saw less of that agreement this year, but I'm not sure if that is because they're focused on other things or if there really truly is this schism between, what they are like, what their priorities are. And so I would be curious, Jay, what you're seeing out there in terms of alignment between payers and providers.
Yeah, I'm not sure I see a schism. I attribute some of it, questions like how much of it, to the fact that both sides have been under pressure, under audit pressure, right? Scrutiny around practices, and also under immense financial pressure. And when you're faced with those kind of headwinds, you get focused pretty narrowly, right? You start to move kind of more internal. And I think some of the less collaboration is largely because people are trying to defend their own turf, because it's a bit of a survival kind of requirement.
That
And do
makes sense.
you want to add to that at all or no?
No, I think between the two, you've covered it. We do have examples, though, within our own world where we're seeing tons of payer-provider collaboration happening. I think it's difficult because it's complicated because we all know that in a good payer-provider collaboration, there's agreement on what technology will best enhance that particular environment, depending on the type of patient population, type of providers, type of conditions that they're seeing. So there's a lot more to it than just, a tech vendor that can solve it. So anyone that's taking a consultative approach and helping payers and providers align before they start making these decisions, I think are doing well. But when you have providers that are just stretched with having to deal with their patient encounters as well as choose technology and fight the payers on that, you see the schism that Ngan was talking about.
And then going back to that question, any advice on how we're expanding interoperability beyond the brick and mortars of these payer-provider relationships?
I think there's policies that HHS and CMS are working on. I thought that there was something that came out that is in comment period right now. So hopefully, I guess from my standpoint, there, HL7 and the continuing push for fire and interoperability from that lens is going to be important as we move forward. And I'll say it again, a lot of the, insurers have in the past helped these organizations that are less well funded to invest in their interoperability, pipelines. And so, I would encourage folks that are on the payer side to still look at that as an investment in like the overall architecture.
As a clinician, I do think that there's attention to population health at that level of social services, housing, etc. And so I believe that we will see that expansion into that space at some point. I just don't know that I have a perspective on the timeline for that. Jay, any closing thoughts on how we provide that whole health, population health, patient perspective? And we'll close out on that.
Well, we were talking about kind of what we see in the 3 to 5 year window. I think we're going to see this. We'll see some maybe standardization around like what does a longitudinal member record look like, patient record. It's something that I think everybody is trying to figure out what that looks like for them. What does that look like in a payer? What does that look like in a provider? I think the AI and interoperability start to bring all that information together and bring that information together in a way that it can be synthesized, normalized, analyzed, and coordinated. So I think we're going to see that come forward. I think that's really exciting. I think we'll probably also see CMS and HHS kind of weigh in, like, and encourage that movement. So I don't know. I'm really excited about where that's going and our ability to also kind of potentially impact it and affect change.
Amazing. I did just find one more question drop into the chat. So, not to prolong our conversation here, you guys have done a phenomenal job. But one closing thought: why does AI feel so hard?
I mean, the thing is that we have been doing AI for a long time in the healthcare field, so it's not anything new. It's just that how people talk about AI today is really all around the large language models, when in reality, in healthcare, we've been using it to do things like project risk and understand when people are likely to get sicker, or to be able to like diagnose somebody who has breast cancer. Like, so we have been using it for a long time. We've been using it in a way that is, different than how people talk about AI today. So I think a lot of this conversation is, it's hard because we're not necessarily using the same language when we talk about AI and how we're implementing it.
Great point.
Yeah, I think Ngan hit it. We're not all talking the same language. What an apple looks like to me, may not look like an apple to you. And it'll get easier when we agree on what an apple is.
I think that is a great closing point to be closing us out on, Jay. So I'd like to thank everyone for attending. I'm going to hand it back to Bailey to give us some closing remarks. Thank you so much to Rise. Thank you,
Before you hand it to Bailey, can I just give a big thanks to Ngan, her team, and Mathematica? It's been great to partner with her organization for the last 2 years. Incredibly strong analytical rigor balanced with industry insight. And so it's been fantastic. And so thank you very, very much.
Thank you, Jay. We've really enjoyed the work.